COVID-19 or coronavirus or novel coronavirus is the biggest disaster of this century, and I think a lot of people have died because of this virus. Unexpected deaths have taken place. Even in the advanced countries who have much developed medical care facilities, they have lost in thousands. China has lost maximum, and now Spain is going to surpass China. US has got great numbers. Even India, we have got some people affected, but thank God, due to our good luck, the country's good luck, and the proactive management by the Prime Minister, Health Minister, Cabinet and other ministries, it has been contained. Our duty at present is most important. It had started at stage 1 through the tourists who came from abroad, mainly the chunk of tourists who came from Italy. After that, tourists kept coming, and then a great deal of it through one of the singers, Miss Kapoor. Because of her, lot of sensationalization of this event took place. Most of the people who went into her event did found negative, so that was a good part of the story. But the whole state of Uttar Pradesh got sensationalized. A traffic from London to Delhi, Kanpur and Lucknow made everywhere sensation, and made, of course, a good thing also happened due to this, that people were aware of precautions. And since next day Prime Minister addressed the nation, and then after 2 days on Sunday we observed a bandh, lockdown and show of self-discipline, followed by 21 days lockdown. This has to be observed because stage 1 not very dangerous. It goes to the cluster stage 2. That means it is limited amongst the contacts of the people, those who have traveled from abroad in them. And the cluster stage should not become a community transmission, and that is the most important point for India to follow, to see, and at any cost we have not to let it spread. The lockdowns, suspension of the religious places, prayers, railways, main public transport on the roads, air travel, trains, offices, schools, colleges, all have been affected. Cinemas, health parlors, all other marketplaces have been stopped to gather the crowd, because we have to manage the crowd. Self-hygiene is most important. Among that is the hand hygiene, repeated washing of the hands. If you can afford to use sanitizer, well and good, but frequency of hand wash should be minimum every 1.5 to 2 hours. Soap and water is a good disinfectant. Any disinfectant or what you call sanitizer should have 66.6% minimum alcohol content, and that is how we can kill the virus. Because virus is not live, it is a protein particle, it is RNA capsid which we can destroy by alcohol, it shrinks. Third stage is very dangerous. And our Prime Minister Modi has been repeatedly asking the nation to follow the discipline of self-quarantine in hospitals, also at homes. Both ways this is important. Majority of people are observing discipline, but many people are showing up on the roads and at crowding places. They should be warned appropriately. The aim of 21 days quarantine is that the virus multiplies for 21 days maximum. The incubation period is 12 days maximum. Some people say it is 14 days. So beyond 2 weeks, 1 week is for sanitization of the society. So that is what Mr. Prime Minister has found out through the experts and is implementing. And he has used a very nice term calling Lakshman Rekha. And Lakshman Rekha is very relevant if we go back to the history of abduction of Sita Ma by Ravan. So Ravan here is corona, and our country is our motherland, Sitama. That's why I called Sitama. So we have to prevent, otherwise we will land in a soup. We are sitting over a disaster. We are sitting on the mouth of a Jwalamukhi. We are also seeing, what are we seeing is the tip of an iceberg. So don't let this spread like the rest of the iceberg, which is 9/10, and also not let this Jwalamukhi explode. If we let this volcano explode, the common man will be affected, everybody will be affected, country will be affected, and nobody can treat, nobody can prevent at that stage. Be careful. Nature is with us, God is with us. That is why we are finding very small number of deaths in India, very small number of reported patients in India. But our duty is prime duty now to prevent ourselves from the spread of infections. There are a number of rumors regarding nutrition, temperature, what to eat, what not to eat, medicines prescribed by Dr. Trump and other people. Please don't go on that. Please listen to what our ministries notify. Our health ministry, our ICMR has notified what medicines to be given, but no self-medication is recommended. Drugs like aspirin and ibuprofen should never be used.